Welcome to this session on examination of varicose veins. Today, in this short session, I'll try to highlight to you the history taking and examination of a patient with varicose veins. First, introduce yourself to the patient. Wash your hands before you touch the patient. Briefly explain to the patient what the examination involves, what you can expect from the examination, especially pain and discomfort. Expose the patient adequately by asking him to remove their bottom stock clothing, exposing the entire lower limb. If necessary, offer a chaperon to the patient. Then start by inspecting of the patient, but be prepared to be instructed to move on quickly to certain sections by the patient, by the examiner. Now, history taking is an important component of the examination of a patient with varicose veins. Okay, a lot of symptoms are included, a long list of symptoms as given here. Okay, and among them, the important ones are aching sensation in the legs and calf, and usually occurs towards the end of the day or after prolonged standing. Same thing, under similar situations, there will be prominence of veins on standing, and this is also seen toward the end of the day. Skin changes, okay, discoloration, swelling, relief by elevation of the leg, ulceration, especially a medial lower third of the leg above the medial malleolus, and there can be bleeding, massive bleeding due to minor trauma, and also to ask about whether the patient is having any pain, which is not a good sign in varicose veins. Okay, now on examination, you go through the usual process of inspection and palpation. These are the two important things. Under inspection, you look at the leg, general contour of the leg, the location of dilated veins, and also the presence of skin changes or edema. Okay, there are a number of signs that you have to look for. Superficial thrombophlebitis, ankle flare, spider veins, reticular veins, Safina varix, Talipes equinovarus, champagne bottle sign of the leg, and atrophic blank. Okay, these are all on inspection. Then on palpation, you palpate for these nerves, these dilated veins, and also palpate for any defects along the course of the vein to suggest it is incompetent perforators. In relation to palpation, you do some special tests. There are quite a number of tests available, but the most important will be the Tenderloin test, the tourniquet test, and the Perthes test. For varicose vein includes, first, look for signs associated with chronic venous insufficiency, CVI, and these include varicose eczema, hemosiderin staining. These are seen as brown patches or brownish discoloration, ulceration commonly located on the medial aspect just above the ankle, lipodermatosclerosis, which is hardening of the skin distally, and also discoloration, swelling of the calf and the leg, presence of scars indicating previous surgery on the limb, and looking for obvious varicosities present in the lower limbs, inspecting both the long and short saphenous veins. Secondly, you also look for signs associated with arterial disease or arterial insufficiency, which will determine the suitability for compression therapy. These include the trophic signs of loss of hair, nail thickening or friability, ulceration, especially at the pressure points, and a very careful examination of the peripheral pulses. Okay, this chart shows you the various tests, clinical tests or special tests that are available for examination of varicose veins. They can be classified into three main groups to detect the saphenofemoral incompetence, perforated incompetence, and deep vein thrombosis. Under the saphenofemoral incompetence, you have the Trendelenburg-1 sign where you occlude the saphenofemoral junction and watch for the refill. Then you have the Morrissey's cough impulse. In perforator incompetence, you have got Trendelenburg-2 test, tourniquet test, Pratt's test, and Fagan's test. In the deep vein thrombosis, the tests involved are the Perthes test, modified Perthes test, Homan sign, and Moses sign. So these are the large number of tests that can be available for patients with varicose veins. Trendelenburg or tourniquet test. The Trendelenburg test is a test of the saphenofemoral incompetence. With the patient lying supine and the veins from the leg drained, occlude the SF junction and then ask the patient to stand. If the varicose veins refill rapidly from below, then the source of the problem is below the SF junction. On the other hand, if on removing the occlusion at the SF junction, it fills from above, then the fault is at the SF junction. Next is the tourniquet test. It is a test of the SF incompetence and the deep perforators of the leg. Again, with the patient lying supine and the veins drained off, the tourniquet is placed around the upper thigh and the patient is asked to stand. If there's rapid filling above the tourniquet, then the saphenofemoral junction is faulty, is incompetent. If there's no filling from above, but rapid filling of the varicose veins from below, the fault is then below the tourniquet. It can be either in the popliteal vein, popliteal saphenous vein, or it can be at the deep perforators. This test is repeated with the tourniquet placed at 3 sites, 1 above and 2 below the knee, to localize the site of the deep perforators that are incompetent. Okay, these are the two important tests which I've mentioned. Trendelenburg test. This is the leg of the patient. Ask the patient to lie down. Elevate the leg to empty the engorged veins in the leg and press on the saphenofemoral junction here. Okay, which is you have to locate the femoral artery, and the saphenofemoral junction is medial and 2 cm below it. Okay, here up the upper thigh. Okay, after that, after occlusion of the SF junction, ask the patient to stand up and watch for the varicose veins. If the varicose veins are controlled, that means there is no filling, then the saphenofemoral junction is incompetent. If not, if there is filling of the veins from below, then there is incompetent perforators below the SF junction here. Okay, in the thighs and in the leg. Now the tourniquet test is the same principle as the Trendelenburg test. So you lie the patient flat, elevate the leg to empty these veins, apply the tourniquet to the upper thigh, and then ask the patient to stand up. If the varicose veins are controlled, incompetence is above the tourniquet, that is at the SF junction. If not, it is below the tourniquet in the deep perforators of the thigh or the leg. Okay, this is the Brody Trendelenburg test.
The patient is lying flat, the leg is elevated, and the veins are drained of blood. Then the patient is asked, there's occlusion over apply a finger to occlude the saphenofemoral junction and ask the patient to stand. If it does not fill from above, then the SF junction is at fault, is incompetent. This is a tourniquet test where a tourniquet is applied to the upper thigh, and similarly the patient is asked to stand. Okay, filling of the veins from below indicate there are problems of incompetence below the application of the tourniquet.
Now, the Perthes test is a test for the give you the indication of the situation of the deep veins, whether they are incompetent or they are thrombosed, deep vein thrombosis. It is done same as a Tenderloin test with a tourniquet at the upper thigh after emptying the blood with superficial veins, and the patient is asked to stand. But in this case, on standing, releases a small amount of volume into the veins. Ask the patient to pump his calves by stand up and down on tiptoes. The veins becomes less prominent if the perforators have competent valves, and more tense if it is incompetent. Okay, so if the deep perforators are competent, then the veins become less prominent. If the deep veins are incompetent, then this action will increase the prominence, or the veins become more tense. You have to note that patient will feel pain when the veins fill up, so be vigilant and ready to stop immediately. Pain to patient in exam is very, very bad.
Next, we come to Perthes test. This is to assess the functioning of the deep veins, whether the deep veins are patent. With the patient again supine, place the tourniquet around the thigh. Ask the patient to raise their heels off the ground 10 times. That means you try to squeeze the calf muscles to act as a pump to squeeze the deep veins. Look for collapse of the superficial veins. Okay, the veins, by the deep veins being pumped, it sucks the blood from the superficial veins, which then should collapse. If the superficial vein collapses, that indicates deep veins are functioning, as blood is returning through the deep vein system as usual. If, however, the superficial veins remain dilated or it becomes more dilated, that suggests there may be a problem with the deep vein system, whether it is obstructed or there may be incompetent valves in the deep vein system that prevents the blood from draining from the superficial system. Then it is considered Perthes test positive. So when Perthes test is positive, it suggests deep vein problem, either deep vein thrombosis or incompetent veins or incompetent perforators. Next, we come to the Doppler ultrasound scan, which has become the most important investigation for venous varicose veins today. Okay, it is very helpful to assess the site of venous incompetence, which is most commonly at the saphenofemoral junction and or at the saphenopopliteal junction. So placing the probe over these junctions will help to determine whether there is any incompetence and reflux of blood. It also is used to assess the patency of the deep venous system. Okay, the deep venous system can be blocked either to DVT, or its function can be affected by incompetent valves and also the presence of perforators. So the Doppler ultrasound can help to assess these situations by assessing the deep venous patency situation. It consists of a duplex ultrasound, which incorporates the sound and image, produces not only the image, it also produces the sound of the blood flow. And nowadays we have this color Doppler ultrasound, which can also allow you to measure the speed of the arterial and venous flow. It can also help you to diagnose peripheral vascular conditions, which are very important to exclude, especially if you are considering compression treatment or surgery for varicose veins.